and welcome everyone. My name is PHIL ATETO, if you don't know me. Raised in Severn, Maryland, went to Glen Burnie High School, go fighting Gophers, and have lived in Annapolis since about 2009. I was diagnosed with multiple myeloma, a form of blood cancer that affects the bone marrow, in August 2010. It's important to understand my situation when I was first diagnosed. I was a healthy 31-year-old, I was a gym rat, ate right, and though perhaps I drank a bit more than my mother would have liked, I otherwise lived what I thought was a healthy lifestyle. But as it goes with life, and is the title of my healthcare blog, stuff happens. I was recovering from the aftermath of the 2008 financial crisis and was waiting tables without any health insurance, and my mother thought that was absolutely ridiculous and pushed me to get a health insurance plan and she would pay for it. Little did I know how fortuitous that would be. Just a few short months later, I started having compression fractures in my spine that the doctors couldn't figure out or dismissed as a muscle strain, followed by a bout with pneumonia that led to my diagnosis. I've added that timely health insurance coverage to the list of things to be hugely grateful for my mother for, as I shudder to think what it would have been like to go through this journey without any insurance. This just shows that it's impossible to predict what kind of health care you will need. You simply need what you need when you need it, and shopping for coverage to try and predict that is just silly. Since my diagnosis, I've had the gamut of experiences in our healthcare system: good, bad, ugly, beautiful, and everything in between. But I'd like to focus on my most recent experience, of which some of you are already aware. In my experience, and from what I understand with incurable cancers like mine, the journey is like a game of Frogger. The doctors have a list of drugs and choose the best ones to treat given your body's responses to them. These drugs may or may not work, and whenever they stop working, it's time to move on to another one. So it's really just a game of time and when, not if, the cancer resurges and becomes unstoppable. So I was lucky to have a good insurance plan with no deductible and a relatively low out-of-pocket maximum. And though my premiums quadrupled from $175 a month in 2009 to $695 this year, I got 9 years of having different drugs work, thankfully with minimal side effects. And I was finally out of options in November 2019, when the last drug I tried had no effect on my blood counts. My doctor felt the best option was a drug called venetoclax, which was showing a lot of promise with my cancer and among the other blood cancers, and it's the center of a lot of excited talk at conferences among doctors who specialize in multiple myeloma. My other alternative was a strong chemo regimen that would keep me in the hospital for 2 weeks and resting at home for another 3 weeks in hopes of buying some time to get me into a trial of my only other option, a CAR T-cell treatment, which I don't have good blood markers for, so it was kind of a bit of a long shot and kind of risky. Enter the insurance company, CareFirst and CVS Caremark Specialty Pharmacy. Because of the costs of the drug, approximately $10,000 to as much as $20,000 a month, depending on the source, and because it's a specialty drug, CareFirst has subcontracted out the decisions on such drugs to CVS Caremark Specialty Pharmacy. The CVS Caremark Specialty Pharmacy initially denied me access to the venetoclax, which sometimes is just insurance policy, but technically because it's not FDA approved for my cancer, although it is in trials and approved for similar blood cancers. My doctor appealed this decision, spending precious time on long holds on the phone to talk to people on the appeal panel who still ultimately denied me the drug with a sort of insulting reason: not medically necessary. My doctor demanded that they have a multiple myeloma specialist call them and discuss the decision. As there was only a general oncologist on the appeal board, my doctor felt he clearly did not understand the fine details of why I needed the venetoclax and why he felt so strongly it would work. That call never came, and when I followed up with Caremark, there were no additional notes past the official appeal decision, despite my doctor following up several times. There was also a call with CareFirst chief medical officer, who my doctor was convinced would approve the drug if he was good at his job, and I was denied at that point as well. This is early December, and I was beginning to feel my body decline, though I tried to do some light exercise as I was still getting over pneumonia, followed by a severe cold in November. When I called, CareFirst kept trying to refer me back to CVS Caremark Specialty Pharmacy, saying it's their decision and trying to absolve themselves of any responsibility. They did have an appeal process that could take up to 30 precious days to decide, and we were looking into other options to obtain the medication. In the meantime, the hospital staff tried to get me approved at another pharmacy, but because it was still going through the CareFirst system, it was denied again. One of the issues was that I was using technically the drug on an off-label use, and pharmacies and reps can get into trouble with the law for marketing drugs for non-FDA approved uses. However, I understand off-label usage is quite common with some drugs. Enter the community. Upon hearing of my situation, my friend and boss at the Backbone campaign put a GoFundMe up to try and finance the cost of the medicine out of pocket, and began working with me to organize actions to pressure Care First. The community responded, and I was flooded with both donations and messages of love and support. Friends with online presences continually reposted the GoFundMe and hammered Care First for denying of care. A friend and I went out to the Care First building and projected messages such as, Care First denies care, Care First condemns friends to death, and all I want for Christmas is a chance to live, hashtag keep PHIL alive. And images of this were circulated around social media, along with further condemnations of Care First. At this point in late December, I'm really feeling the decline in my physical health. I'm short of breath and winded after walking short distances, and I can feel the muscles atrophying and myself getting weaker, accompanied by serious fatigue. Because I'm out of options, I was planning to end the last few months of my life, both mentally and in my life. I decided to forego the other option with the intense chemo because if this was going to be my last Christmas and New Year's with loved ones and friends who were coming to visit after hearing my situation, it wasn't going to be in the hospital. It was an extremely emotionally stressful time. I want to thank the people in the community that came out to uplift me in this extremely difficult time that was crucial in getting me through. I didn't realize how many lives I had touched until the love and support came flooding in. And I'm sincerely and eternally grateful for that, the continuing support I receive when y'all see me around. So I'm having dinner on Christmas Eve with my wife and her family, and I get a call while we're out. It was from a number I didn't know, but with everything going on, I felt compelled to answer it. It turned out it was Care First customer service department calling to try and smooth over everything with me as they had seen all the social media posts. She tried to explain that the venetoclax isn't FDA approved for my cancer, and therefore it's considered experimental and therefore not covered. I told her that it's 100% in their power to approve me for this drug, and that they want this to be a simple black and white issue, but it is not. She responded that they approved me that they would have to start approving other people for drugs that were considered experimental. And that would just be anarchy. Heaven forbid health care is expanded for people. Needless to say, we never managed to reconcile our differences. However, I got off that call with a small sense of hope. This let me know that the community pressure was being noticed and possibly even working. This showed me that they're susceptible to community pressure and aware of their public interests, and we can use that. Organizing for another more escalated action at the Care First building, we're in full swing at this point to press them even harder. Then on the afternoon of New Year's Eve, I get an ecstatic call from my nurse that they approved the venetoclax, and I'll have it by Friday. We have an excited, joyful short call going over the details. It turns out that one man, the VP chief officer with Care First, made the decision to approve the medication. I'm not a big New Year's person, but that news made this one extra sweet and enjoyable and allowed me to enter the new year with a strong sense of hope that I might be around for a while longer. I'm overjoyed to report that I've been on the venetoclax for 3 weeks now, and last week my numbers were so good when the nurse told my doctor he didn't believe her and went to look them up for himself. And the counts continued to decline this week. Thank you, I appreciate the love. The cancer cells in my blood counts have been slashed in half from what it was less than a month ago. The decline in my body seems to have stopped, and I've noticed I have more energy and stamina and much less fatigue, and feel like with some concerted efforts with light exercise, I might have another good go of life for a while longer. Although I recognize these drugs can stop working after just a few months, I'm cautiously optimistic and feel like I have a new lease on life. I'm tremendously grateful for my doctor and his team as they fought hard for me by advocating, imploring, shaming, and pushing Care First and CVS Caremark to get me this medicine. And again, I'm deeply grateful to the community, especially for being down to push the envelope with me at the actions we had planned to do at Care First. Although part of me is sorry we never got the chance to do them, we can use, got something for them. We can use them when we inevitably need to challenge this system again. So if this were a Hollywood movie, this would be the point where we roll the credits and everything's tied up with a nice, neat bow and everyone lives happily ever after. And while I'm grateful and overjoyed at my situation to be cheating death for a while longer in the short term, I feel the journey to get to this point over the last couple months is a further indictment of our healthcare system. Why should someone have to have their doctor relentlessly argue and also ask the community to mobilize to get life-saving medicine? Why are 1/3 of GoFundMes for healthcare expensive? The outcome would not have been the same for many others who are less fortunate than I am. Mine is one of countless stories of denied care and a glimpse at the ugly side of our healthcare system. And although mine has a happy ending in the short term, as do some others, there are far too many stories of unnecessary suffering and death that occur for us to tolerate it any longer. Similar to justice, Delayed health care can be as bad and deadly as denied care, and it almost was for me. The reality is that I'm approved for 2 months of the venetoclax drug, but my continued treatment quite literally rests in the hands of one man. The VP Chief Officer at CareFirst can arbitrarily decide that I don't deserve to be treated and live a while longer, just the same as he approved it. I'm grateful that the community is already engaged in case this becomes an issue again. With whatever time I have left, this experience has re-steeled my commitment to fighting for the just, humane, single-payer, improved Medicare for all system we all deserve. And I hope that we can learn more together today about what it would look like, how we can achieve it, and then link arms and go out and make it happen together. Let's do it.